Hello guys, my name is Anita Luanga. I'm a physician that specializes in geriatrics and internal medicine. We have been talking about anemia. In the previous videos, I talked about what anemia is and how anemia occurs. In this video, I'm going to talk about how we treat anemia. So as I mentioned before, anemia can occur either during the pre-production phase of the red blood cells life cycle, during the production, and during the post-production phase of the red blood cells life cycle. I also mentioned that anemia is a condition that indicates there's another disease process going on. So with that in mind, the primary treatment of anemia is to treat the primary disease process. For example, if somebody has kidney issues and they're not producing enough epogen or EPO, in addition to treating the kidney disease, they might get a hormone to replace the EPO that their body makes. Another example is if somebody is having a heavy menstrual cycle or is vomiting blood, in addition to stopping the excessive bleeding, the individual might have to get red blood cells, especially if their hemoglobin is below 70. But if you imagine the situation where somebody's having a heavy period and we just give them red blood cells and then send them home, their anemia will not be fixed. They might end up coming back to the hospital with complaints of symptoms, and then we just give them more blood, and that doesn't really solve the primary issue. There are a lot of causes of anemia, and again, as I mentioned, they fall into those three categories, but depending on the specific issue, it's best to address that issue, and your doctor will know how to do that. I hope you found my series on anemia useful and informative. Bye-bye for now.